safe. You have asked people to get vaccinated. You've asked them to wear their masks because in your heart you know this is an important community that needs to know that we care about them. And what you have done is, as partnering with the state, is something we so appreciate. And you have said you need more resources to continue the work you want to do. And I will stand here and tell you those resources are coming. And I will guarantee that you'll get additional assistance, those who are willing to be so supportive of what we've asked the people to do, our businesses, to make sure that people are either masked or vaccinated when they come into their establishments. And that's how we're going to protect wonderful communities like Warsaw and throughout this great county of Wyoming. So thank you. Mayor Joe Robinson. Where's Joe? Oh, Joe. Here, Joe. Been to many diners with you, and Trustee Cindy Applin. I used to get to the point I'd walk into the diners, they'd automatically hand me the iced tea and the drinks, usually rice pudding too. So thank you for being on the front lines for such a long time and doing everything you can to make sure the people of this community are safe as well. So this is what this is all about. I literally just came here for one reason, and that is to thank angels on earth, these healthcare workers who continue to show up, whether it's in the skilled nursing facility or on the front lines, walking through these halls, taking care of people at their most vulnerable. They have been through a long, excruciating time, and like any other human would be, they're exhausted. They walk in with a positive attitude every day, but they walk out feeling drained in the sense of it did not have to be this way. If we could get more people vaccinated, and as this Omicron variant continues to expand exponentially, we have to make sure that people get the booster shot as well, because all the evidence is showing that there will be breakthroughs. And thank God the symptoms will not be as severe. We've already seen evidence of that, but there will be people hospitalized. And increasing hospital capacity has been my laser focus for many months now, not just dealing with Delta, but when we first got the inkling that this could come from South Africa and England and eventually come to New York, we knew once it came to New York that this would spread like wildfire because of densely populated areas like New York City, but also areas of our state where people are not as vaccinated at the high rate we want them to be. So we saw the vulnerabilities right away. We've been working on hospital capacity since day one, and I want to thank the leadership here for making all the right decisions to ensure that there is sufficient capacity in this very hospital. I applaud you for that. It is not easy to do, and you have approximately 24 COVID patients right now, or 24 people hospitalized, and half of them are COVID patients. And sure as I'm standing here, that number is going to continue going upward as the Omicron variant continues to spread. So making sure you have sufficient capacity as well as nursing home capacity, because many people who could be released from hospitals sometimes are having to be kept in a hospital even longer because there's not enough staffing at a nursing facility in the community. So those are areas we're focused on very much. I do want to make a couple of other points. This is not March of 2020. It's not even December of 2020. We've come a long way. We have defenses. We are not defenseless against this virus or even the variant. We have all the options we need, and that is vaccinations for children on up from age 5 all the way to adults, making sure they're safe, they can return to school when they come back from their Christmas breaks, also making sure that people get the booster shot, as well as the availability of testing and vaccination sites throughout the state. We're continuing to add more and more. We're talking, we're in regular contact with county executives, county leaders, county boards of supervisors, as well as the local public health departments to find out what they need. We also are going to have a very, very expansive testing program where we're going to be having a portal available for people to be able to order test kits. At some point, we're setting that up as we speak, focusing on areas where there is a lower compliance rate, because what we want to do is make sure that people show symptoms, that they get tested, or if they've been exposed, they get tested, because this is how we can stop the spread from getting even more out of control. If people are feeling sniffles, a little bit sick, get tested right away. We want to make sure that you stay home, stay protected, don't spread the virus. On the other hand, we're going to end up with another situation. We're not going to have enough people working in our various facilities or working in our restaurants, working in our various businesses that populate downtowns like Warsaw here. And we want to make sure that they're tested, know whether it's just a common cold or they have the flu, allergies, or whether it really is COVID. So having that data point is really important to know exactly what you have. So we actually focusing on more availability of testing kits, hospital capacity, more vaccinations as well. And as I mentioned, more tests are on the way. This is a county that has over 6,000 people have tested positive for COVID right now. That's out of a population of 40,000. You do the math. That's about 14% of the population testing positive. And these are people who test positive in places where we can track them. People who may be now diagnosing themselves at home because they have the test at home. We're not always getting that data. We want to make sure that people know. Call into your local health department so we can have more accurate numbers. So those numbers are troubling. And I predict that after Christmas, they're going to continue to go up. We foresee this. But it does not have to have anywhere near the same severity as we went through a year and a half ago, 20 months ago. We have the protection to avoid that situation. So I will once again ask everyone, please, if you're not vaccinated, now is the time. Think of the most vulnerable person at your dinner table for Christmas. And are you at risk of making them sick because of something that you simply would not do, and that is to get vaccinated? So please do that for your loved ones so they can join you again next Christmas, next holiday season, as well as get that booster shot. Please get the booster shot. And we also have a lot of cases where someone may have gotten only one of the boosters or one of the vaccinations from Moderna or Pfizer. They require 2 shots. You need to get at least those 2 and then the 3rd shot. So please don't think because of 1 dose that you're safe, because you are truly not, particularly with this new variant. So that's what I want to leave you with is, again, thank you to healthcare workers, not just here in Wyoming County, but across the state of New York. We are so grateful for what you've been through and what you continue to do every single day. You inspire us. Your stories, what you continue to do at your own risk yourselves and your family, is truly extraordinary. We're grateful. We're going to give a hand to our local counties who are doing the right thing. I want to thank Wyoming County for helping us keep people safe, and all the elected leaders and the hospital staff who are here today. I want to wish you all a Merry Christmas and a Happy Holidays, and look forward to a healthy new year heading into 2022. So thank you. Any questions?
Governor, you talked a lot about vaccinations. We talked a lot about masking here locally. Not as much about testing, though. Can you just talk a little bit about your thoughts, the state's thoughts on at-home testing in particular, and the availability of testing to consumers?
We have been ordering tests from the over the past few weeks in particular. We just had an arrival of 1 million testing kits. We have another million coming next week and another million coming the week after that. And I'm putting an even larger order in. So we're going to make sure we have what we need. What we're doing is getting them, first of all, out to healthcare facilities. So if someone's discharged, they can make sure that they can retest, make sure they're safe at home. Getting the local health departments a supply. I just think 3,200 arriving today.
That's correct.
All right, it might be on Santa's sleigh out there, I'm not sure, but there's 3,200 coming to even this small county. So we are getting them out to local health departments, working with our counties, making sure it's available. But some counties are even dropping them off in libraries, and we want to get them in schools. My goal is to make sure that when kids return to school on January 3rd, that they can stay in school if they test negative, and we'll get those testing kits to the parents. So a lot of workplaces also make them available. My number one job is to make sure there's ample supply of those at-home tests as well as the PCR tests. Also embedding more of our testing into our existing vaccination sites so they can have a dual purpose. We have some that are already doing that. I want to ramp that up as well. So when people are not feeling well, they don't have to be scouring their community trying to get a testing kit or find a facility that'll test them. So yes, testing is a high priority, because what we anticipate, more and more people are going to be testing positive from this. We want them to, even if they're testing at home, just stay home. Do not go out. Don't go to work. Don't go see your family. That's how we can start isolating the spread. And it does not have to be long term. It's a shorter time frame. Find out that whether or not you're positive, get another test to find out you're negative, and then you can resume your normal activities.
Governor, with the Omicron variant now spreading throughout the country, and obviously Delta is still a big problem, do you expect to see more mandates on the horizon, and particularly a vaccine mandate for schools? Is that coming?
Vaccine mandates in the way New York state law is, it has to be approved by the state legislature, and they've not approved this particular vaccine. They have a long list of vaccines that are required in order to go to school. And I think that's a good reminder to all the parents. Your children are already vaccinated, or they would not be in school in the first place. So this is a routine function, making sure that your children will not ever contract diseases like polio that killed so many thousands of Americans, and we don't need to talk about it now because a vaccine is so routine. We will get to that point, but other steps have to be taken. But my number one priority with respect to children is to allow them to stay in school. We saw an experiment, and God bless the teachers who are trying to teach children remotely, and all the parents who are trying to be the at-home teachers at the kitchen table. We saw huge disparities. Areas like Wyoming County, where there's rural poor, not everyone could afford to have the broadband. Not everybody has an iPad. So it was an attempt to make the best of a very bad situation, but we don't have to do that again. We can make sure that we're encouraging everybody to get their children and grandchildren vaccinated so they're safe when they go back, but also so in case there is a case in a classroom, we can give parents testing kits so they can stay in school unless they test positive. That's our objective, to change the whole model of, instead of immediately people rushing home, it is stay in school, stay learning, and stay in a nurturing environment, because that's what we missed for a long time.
We have time for one more then.
Perhaps
Up here.
I just wanted to mention, you mentioned that the COVID rate is high here, and I wondered if you could correlate that to the vaccination rate that's currently here, and are you attributing that to a low vaccination rate, or just people not getting a booster, or what do you think?
I have the numbers on our vaccination rate here, and it's not outstanding. We can do a little bit better here. I think it's, right now, our county fully vaxxed rate is 56%. That's a vulnerability. That is a high vulnerability. And that is not even including all those who are boosted. So I know that statewide, we are considerably higher than that. And I believe that'll make a difference. But that does not mean we're not going to see positive cases with people who are vaccinated and boosted. I want to be real clear on that. But the issue is the severity. The people who are unvaccinated are far more likely, if they contract Omicron, to end up right here in this hospital. That's what we don't want to see. These overworked, exhausted healthcare workers do not want to see that either. So we can protect, and yes, there is a correlation right now between not just I would say look at more than cases, look at hospitalizations. Look at the hospitalization rate. Those are the numbers that are causing greatest concern to me, to be working tirelessly to make sure we have the capacity to handle everybody who's sick, but they don't have to be sick. There's still plenty of time to get the vaccine, if been vaccinated, get the booster shot. We're making it so available. It's out there. We don't have that shortage that we were all dealing with just less than a year ago when everybody wanted to get it, but they couldn't get it. And then the at-home test kits and testing facilities. All this is part of an overall strategy on how we can get people of the state of New York safe and healthy, but also keep our economy healthy. I don't want to have the little businesses downtown that had a shutter last year, the little restaurants and the pharmacies and the little shops that I've always visited. I don't want them hurt again. Their owners work so hard. And if all we do is wear a mask when we go in there, or vaccinated, they have a vaccination requirement, we follow that, we'll be all doing our part to make sure not just that we're healthy, but our little small towns are healthy as well. And that's something I feel we should all feel responsible for. So thank you, everybody. I do have to get on the road, but I do appreciate you coming out today.
Have you changed your holiday plans because of concern over COVID?
My holiday plans?
Yes.
I am not flying to Florida to see my dad, that's for sure. I wasn't sure if I would in the first place, and as this started, once Omicron hit, I said to our family, I'm staying in Albany. I'll be managing this throughout the weekend, so that has changed. It's not a fear of flying it, it's just I need to be in Albany to manage this crisis, and so I will not be having any holiday plans, maybe a dinner with my husband. All right, thank you.
Bills leads, Governor? The Bills fans want to know, the end of the year has been mentioned as a benchmark. Where are we at on the Bills leads?
We have had conversations, and I've made it clear to the Buffalo Bills organization that we wanted to accommodate both options and let them see the cost of downtown and Orchard Park, but not putting our finger on the scale. And if their desire is Orchard Park, it's Orchard Park. We've never said otherwise, and we've had many conversations. I've also offered 2 timelines to them, whatever works best for them. I can get this done by the end of this year. I can get this done. We can work out the numbers. We're having good conversations. Or I also have until the end of March because it is a budgetary item. So I also have a larger window if we need more time. So it's not a hard deadline. But my desire is, I'm a Buffalo Bills fan. Let's lock this down. Let's get it done. So we are very intently focused on keeping the Bills here. If Orchard Park's their first choice, their only choice, it's Orchard Park, and we'll make it all happen. So we're very excited about announcing a deal, hopefully in the near future, but a lot of devil in the details. Thank you, everybody.